So welcome to the Yoga Therapy Toolbox, and this is Yoga Therapy tool number 9. And this one has got to do with contraindications. And how do we work with contraindications? These might sound easy, but actually is not. So some contraindications are completely fixed. What does that mean? That imagine there's a client who is recovering from stroke. The high blood pressure is relatively controlled with medication, and they have the symptoms and side effects of the stroke, which could be stiffness and tightness on one side of the body. And anybody who has experienced a stroke, they have a higher risk of having another one. So the contraindications here are going to be no inversions, because that will put pressure on the very delicate arteries of the brain, no pressure on the neck, exactly for the same reason, no pressure on the chest and abdomen. Now, those contraindications are completely fixed. So no matter what, I'm never going to do those practices with this client who is recovering from a stroke. Now, that client might come with lower back pain to my clinic. So yes, I'm going to do some practices and exercises and movement, breathing techniques that could help and improve their lower back pain. But I'm always going to stay away from inversions, pressure on the head, on the neck, on the chest, or the abdomen, no matter what. Now, in some cases, for example, somebody with a lumbar herniated disc, L5S1, at the beginning when that hernia is first diagnosed and is at its most painful stage, I'm going to avoid forward folds. Why? Because that can actually make the hernia worse. However, as the client progresses and the pain gets better, maybe it was 6 months ago that they had the hernia, I might be able to introduce some gentle, for example, cat and cow. Cat and cow has a slightly rounding of the lower back. It's not a full forward fold, but I would be able to introduce those lovely tilting of the pelvis, rounding of the lower back that could be beneficial at this stage. So in that case, when I say for herniated disc L5S1, no forward folds, well, when the hernia improves, when it's slightly maybe, yes, being reabsorbed by the body, when it's been 6 months, 7 months, a year since the hernia, then we're gradually going to make that contraindication a little bit softer, a little bit less fixed. We're going to be less strict with it. And we might even be able to do some very gentle rounding forward movements. So as a yoga therapist, it's important that A, you learn these things with training, but B, as well, you can find out and you can discover. It's very important that you learn this, that, for example, somebody with inflammatory bowel disease, Crohn's disease, if they do a deep forward fold, that might cause bleeding because IBD involves some ulcerization of the intestines. So when you do a deep forward fold, that could cause compression and pressure on the ulcers and cause bleeding. And that could even be a reason for hospitalization. In some cases, some of the contraindications involve even life-threatening situations. So in those cases, those contraindications are fixed. And when we train as yoga therapists, I always make sure that I say, be very clear of your contraindications and how important they are. And if they really could be life-threatening for your client, no matter what, you're not going to do it. However, some of them could be a little bit more flexible. So this is something that is very important for you to take into consideration, and you will give priority to safety. So learning how to prioritize, learn your contraindications, and then decide, is this one a fixed one and I'm never going to go there? Or is this one a contraindication that I might be able to be more flexible with? I might be able to offer some variations, some adaptations, especially as the client's health improves. That is something that you have to have very clear and write it down. Speak to your mentors, speak to a supervisor, find out the health issues that your client is experiencing, work out your contraindications, and then stick to them. Thank you for listening, and see you next week.